We all know someone with a chronic health problem. In fact, it may surprise you to learn that 1 in 7 children has a chronic condition, often with special healthcare needs that can be challenging to the family and to healthcare professionals.
The biggest fear in all of our minds is losing a child. Unfortunately, there's too many of us that have been down this road, but you don't have to do it alone.
Heart defects are the most common birth defect, and that explains our focus.
Hypoplastic left heart syndrome is the most complex of the heart disease that we take care of.
It became clear that we should work with children and their families during the first months of life when the morbidity and mortality is so high.
Pediatric cardiology practices have been isolated, and as a result, we don't have data. And without data, you can't make change.
What if parents and doctors began working together to make life better for these children? What if clinicians and parents sought to achieve a vision of improved care and, more importantly, improved outcomes? For children born with complex congenital heart disease, that process has begun.
In this collaborative, we are actually finding out some answers.
Now, what's really great is increasing collaboration between individual institutions.
The collaborative's been able to give a structure. Part of what we do is bring together a registry of these kids, track data, we feed it back to teams each month so they can work locally to make the changes, helping to standardize the way care is done.
3 to 5 years ago, it was widely accepted that this child has a single ventricle, they're just not going to grow. But we don't accept that as even a possibility anymore.
One of the exciting parts of the collaborative is to see data presented that shows the improvements we've been able to accomplish.
And to be able to meet with people from all over the country and network and come to some consensus on what is sound practice has both sped up the process and made it more accurate.
And it's also been good to see the honesty and see the transparency that has gone on between everybody.
We already had an existing single ventricle program, but participating in the collaborative really opened our eyes to take a step back and evaluate what we're doing.
The involvement of parents in the entire collaborative has been a life-changing, career-changing experience.
My son here has half a heart. He's been the picture of health. Our cardiologist calls him his rock star. The collaborative is extremely impactful. That not only are they talking about doing something, they're going back to their hospitals and doing something.
My OB doctor diagnosed at 13 weeks that our baby was going to have heart issues. We didn't know if we'd have a baby or not.
Would he be able to enjoy life? We just marvel at all the things we've seen him enjoy.
I'm a great believer in nourishing hope. It's an enormous opportunity to make the extremely rare feel somewhat less rare.
I have been into 2 heart surgery, 1 open heart surgery. I didn't feel any different from any other kid, really. Health is a very big part of my life. I'm trying to become a filmmaker.
The collaborative has been inspirational by helping us to work together, to work with families, and to learn real quality improvement science, all towards the end of improving the lives of these children with serious heart disease.